Imperial County is the epicenter of California's COVID-19 pandemic, and with an infection rate substantially higher than the rest of California, the county's U.S.-Mexico border hospitals are reaching their breaking points. Joining us now to discuss what's happening there on the front lines from California's hardest-hit county is CEO of Centro Regional Medical Center, Dr. Adolphe Edward. And thank you so much for being with us, Dr. Edward. Can you talk a little bit about the influx of COVID cases you're seeing now and how your hospital is managing this increasingly growing number of patients?
Absolutely. Thank you very much for having me on. We're seeing patients come to us from a variety of sources. One source, of course, is folks coming in, U.S. citizens coming in from across the border. We heard this weekend that Mexicali, for example, had opened up its restaurants again. Every time that happens, our numbers are going to go up. So we're expecting the numbers to rise. We've expanded our ICU capacity this week. We're going to go up to 30 beds, from 12 beds ICU to 30 beds ICU. We also expanded our available staff beds up to 117 beds to be able to accommodate that increase. Unfortunately for us, all the surrounding counties that had opened up had created to us an influx of patients that have been coming in.
Yeah, and in this influx, are you seeing any commonalities among these cases?
Well, we're hearing now from the contact tracing that a lot of them are actually happening in the backyards of folks. We're also happening in outer counties and are coming in, or from Mexicali and coming into the county. So all of this results in that multifactorial increase in numbers, and that's normally not a good thing. And that's why our bed capacity keeps rising. But we're going to get to a limit where we're not going to be able to. And that's why I'd asked the California State Office of Emergency Management if we can actually have what we used to call in the Air Force an EMEDS, which is basically an external hospital, 50 beds, so we can accommodate even more cases.
Yeah, that is frightening that it's gotten to that place there. Why do you believe the numbers are growing so rapidly in your community?
People are getting really bored from being at home, so they're driving 4 or 5 hours to another county where it's open, restaurants are open, and then they're coming back. And as you know, the second largest hit group of folks that are now testing positive are restaurant employees. So it's not going to be an easy thing.
No, it's tough for everyone, and especially for the people there, your frontline workers. How are they holding up, and what are you doing to continue to protect them?
Well, the resiliency after 5 months kind of get at you, right? So even though we have a resilient group, and I'm very thankful for having them, we're very thankful that the state has been able to provide us with a whole bunch of things. The DMAT teams, we got 2 of those. We got the Air Force Reserve that came in and actually helped us. We're now getting some more state nurses, ICU nurses, med-surg nurses to try to help kind of give our staff a little bit of a break. But all of this is to a very expensive cost of close to $8 million just for the extra staff for 13 weeks. So can you imagine the impact that financially we were going to have as hospitals actually stretch its dollars and break its dollar, because we're not going to be able to sustain this.
Yeah, and my last question was speaking to that specifically. What are the needs right now of your hospital? What do you need? What's most pressing at this point?
We're really asking for intensivists, physicians, pulmonologists. We're asking for ICU staff, med-surg nurses. That's really so that we can sustain the level and then increase some more. And I'm very thankful for everybody that's already come here and helped us, but that's going to continue into the next year. I think this is not going to go away anytime soon.
Yeah, well, Dr. Edward, we certainly want to tell you how much we appreciate you, all that you and your staff have continued to do all these months. Please be well and stay healthy.
Thank you, GMA. Thank you very much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.